In continuation with the vaginal discharges that I've just looked at, um, chronic cervicitis or cervical cancer can also give vaginal discharge. Also, if there's a foreign body in the vagina, that can also give the vaginal discharge as well. I do want to go further looking at the different infections, the different vaginal infections that can occur. All right, first we look at Trichomonas vaginalis, and we say that, sorry, we want to look at the infections, the signs and symptoms, and the treatment that is normally used. I do look at Trichomonas vaginalis, and Trichomonas vaginitis, and it's caused by Trichomonas vaginalis. And the color can be greenish or yellowish, frothy, foul smelling, and you might have small, like a raised spots, like some little spots in the genital area, but you will only identify it when the discharge is cleaned from the area. Then you will see the spot, the sores. These are sometimes due to itching. So after cleaning, carefully looking at it, then you will see it. Right. This is normally treated with like flagell or metronidazole. Say like between 1 or 2 weeks treatment, and it's usually like pessaries where the tablets is inserted at night. There's a possibility of recurrence, so we normally advise to get the partner treated, because if the partner is not treated, because the partner might not be showing any signs and symptoms, and then if left untreated, you get your treatment, then going back again, continuing with sexual intercourse, then that could cause the recurrence. All right, we have the moniliasis, or the candidiasis, and this is the yeast infection, and the cause is Candida albicans. Candida albicans, yes. With this one, there's a thick, cheesy discharge, like cottage cheese, curdy, right, or flaky. You will have pruritus of the vulva, which is pruritus is really itching, and the vulva is the outer section of the genital area, the vulva, the external part of the female genital. Yes. You can also have bleeding from the vulva after removing the flakes from the area. How do they diagnose this? It's diagnosed by a vaginal swab, and the specimen is sent to the lab, and then it's confirmed. The diagnosis is confirmed to say yes, it's Candida albicans that is found. All right. The treatment for this one is usually canesten, pessaries, and when I say pessaries, are nystatin, where it is inserted, and it's like one is inserted nightly for say 3 weeks or so. All right, there's a gonorrhea now, and the gonorrhea, it's a serious condition that can affect the baby, um, and cause blindness. It can even cause blindness. Yeah, it the gonorrhea causes a condition that is called ophthalmia neonatorum. Yes, and the small one in the babies, then it can cause the baby to be blind. Um, when the baby is in the hospital, when the baby is delivered in hospital, and there's a yellow tube that is used to with this yellow looking it's tetracycline high ointment. And sometimes you know the parent might come to the hospital, and when they see the baby, the eye, they might, what is this in the eye? But that is what they normally do. It's used as a prophylaxis to prevent infection going in the baby eye. Yeah, and that is one of the main one why what that it is protected against, and it's the ophthalmia neonatorum. All right. With the signs and symptoms of the gonorrhea is purulent discharge from the cervix or the urethra. And when I say purulent, I mean pus coming from the the cervix or the urethra or the vulva. The cervix or the urethra, sorry. The cervix is the neck of the womb, and the urethra is the tube leading from the bladder that the female passes the urine through. I know that some people who might not be aware of the anatomical position of the body will tell you that the lady pass urine through her vagina, but that's not so. The urethra is situated above the vagina. So that's it. So you will have pus in that area. There's a Bartholin gland area in the genital area, in the vulva, that the Bartholin glands, and sometimes the Bartholin cyst can develop. And with the Bartholin cyst, it's something very painful, scary, because you see the lady, she's unable to walk properly. One foot over there, one foot over this side. And if you should look at it, then you would see it literally swollen. And what they normally do to get down the swelling is to make a slit in the Bartholin glands to drain the pus from it. So it can be terrible. Alright, for the gonorrhea now, urinary frequency of micturition, the lady passes her urine very often. And you might have dysuria where it pains to pass the urine, and dysuria painful and difficult to pass the urine. Yes, if it's tested, if the urine is tested, then pus can be identified in the urine. Yes. How does this one diagnosed? It's diagnosed using a swab. You take a swab of the genital area, and then it goes to the lab. It goes to the lab, and then they will confirm that it's really gonorrhea. Yeah. Um, the eyes and the joints, the body, joints of the body, and the eyes of the individual can also be affected if it's there for too long, left untreated. Right. So that's in the advanced stage of it. Right. So we look at Trichomonas vaginalis, and we look at gonorrhea. Mm-hmm. All right. With gonorrhea now, once the midwife suspect it, then immediately refer to see the doctor, because I mean, like I said, the life of the baby is at risk, so you cannot play with that. Yeah, and they will do the blood test. They normally do blood tests when a patient comes in with gonorrhea, because they want to also check if the person is, if there's any syphilis in the blood as well. So they don't just check for the gonorrhea, they check for syphilis as well as the gonorrhea. This one, with that, the treatment is usually high dose of penicillin for like 7 to 10 days. Mm-hmm. Yes, that's it. Alright, another one that I want to look on is chronic cervicitis. And this chronic cervicitis, like chronic mean long term, that is happening for over time, and cervicitis is inflammation of the cervix. And I like I said earlier, the cervix is the neck of the womb. This is a section that connects it's between the vagina and the uterus. That's the cervix. Right. So with the cervicitis, you will have thick mucopurulent discharge, and coming from the vagina. But with this, since the lady is pregnant, there's no treatment necessary. Treatment is not necessary given to her. Instead, she's advised about vaginal toiletry. That means how to care for the vagina. So you go wear cotton panties, no tight, nothing. I mean, like, tights. So, ventilation at that point is very important. So because the tight underwear, like tights and those things too, it will help to increase the infection. So you do that, and of course, personal hygiene, you shower, keep the area dry, clean, and things like that. Yes. Um, Another one that I'll be looking at is bacterial vaginosis. And with the bacterial vaginosis, there's a grave vaginal discharge, itching, and irritation. And it's offensive. There's also redness around the vulva or the vaginal opening. Mm-hmm. So we cover bacterial vaginosis, chronic cervicitis, gonorrhea, trichomonas vaginalis, and we look at the candy no, we covered that already. Mm-hmm. Right. Mm-hmm. All right. we have some abnormal vaginal discharges. Just to recap, some abnormal vaginal discharges that you might want to advise your patient to see a doctor is, and remember, vaginal discharges, as it said, discharges is anything that comes from the vagina. It doesn't have to be water, it doesn't have to be pus, it doesn't have to be whatever, but anything that comes from the vagina would be a discharge. Alright, if the man comes in with itching, pain and discomfort, discharge that is frothy and like cottage cheese, bleeding between periods, spotting after sex, bleeding after menopause, and I mean, when I say spotting after sex, that occurs regularly. Because you imagine if somebody has not had sex for quite some time and a little spotting for quite a while, then, that's not something that would get, too anxious about, referring. We just observe and see how it turns. Alright, if the discharge is green or yellow, and if it has strong vaginal odor, because sometimes they are very offensive. If the person have burning sensation during urination, and if there is an increase in the amount of vaginal discharge way above the normal, you call it leukorrhea, then those are some of the things that you'd want to see, refer the person to see a doctor, because it could be something. Alright, yes, so I think that is that in a nutshell. Until, thanks for watching, and please remember to like, share, and subscribe to my channel. Tell a friend to tell a friend. And until, thank you.